So my name is Kashumba, and I'm actually an advanced practice provider. And early 2001, I started having issues with walking. It was gradually, progressively getting worse, and I actually could not walk at some point. So my initial visit with Dr. Palumbo was, he listened to me. As a provider, this is something that I also strive to do, is listen to my patients. We discussed several options. Because of my age, I personally did not want to have a hip replacement. My hips had not collapsed at that point, and so we opted for core decompression with BMAC, which we did successfully, and I'm actually able to walk now. So I actually had two surgeries. My first surgery was November 18th last year. We did my right hip first because the avascular necrosis was more on my right hip. So we opted to do that first. And then I was on bed rest, non-weight bearing for 3 months. And then we did my left hip on January 18th. And then I was on bed rest, non-weight bearing for another 3 months. So it was 6 months of not being able to walk, wheelchair, walker, crutches, and not being able to do the activities of daily living that I was used to. My recovery process was easier because we had discussed what it would entail. With Dr. Palumbo, Erica, and everyone at FOI, my physical therapist, Monson, we discussed what it would entail. We discussed how long it would be. We discussed what my precautions would be. So when I went into it, I knew what I was going into. And I think that was one of the reasons that I've been able to have good outcomes. I'm able to walk. I was a 36-year-old healthy female. I went to the gym. I was a nurse practitioner serving other people in the community. And I went from being that to being debilitated and not being able to walk. So just the mere fact that I'm able to get up and go get water, that's life-changing for me. So I would recommend FOI to anyone who has any orthopedic issue, because they not only take care of patients, but they listen to patients and treat them like human beings.